we go.
These are the deeper stitches. Or stitches going in. See, this is actually what's holding it together.
Do those dissolve on their own?
These do. The ones on the outside let they come out. But
Oh, okay. Do you know that I went to Largo Med to see if they could take this out and they wouldn't do it?
why is that?
They said it needed to be done in a surgical situation. I'm like, well, what are you? I mean, really, right? Charged me $100 copay to tell me that.
Well, they had to evaluate it first, didn't they? But they said you had to be put under and all that stuff for this.
No, not put under, but just in a surgical environment.
Well, this is a surgical environment, but they
Right.
went to the outpatient OR. We just have them kind of set up in their office. Now, see how it still poofs up at either ends there? You can't really see it, can you? See that? You can look at it. See how it poofs up there?
Yeah.
I'm going to take that poofiness out a little bit, but just kind of...
Okay. I'm like, I don't really like to watch you do it, but I'll do it and then go back and watch it.
See how that lays down flatter there?
Whatever you need to do.
I'm just explaining. That way you can kind of understand. Makes it a little longer, but it'll lay down flatter.
It's wild how I can watch you cut on me and I don't feel it.
Well, you're Mississippi.
You're trimming it up.
Mm-hmm. It'll just lay flatter.
So this wasn't any complications or anything. It was like you're pretty much done.
Yeah, there's no complications. I mean, the biggest risk of this is infection. You know, any open wound can get an infection. Usually, these, bacteria is not growing on these sterile tools; they're growing on your skin. That's why we clean it up so much. That's why you get the sterile drape and So, what you want to do is when you clean it up each day, we'll go over wound care. That way, you have it on there too. I want you to leave our dressing on there for at least 2 days, maybe 3. Don't get it wet, okay, until then. After that, you can get it soapy wet in the shower. Just a little soapy wet. You can bring patients back too if you want.
Yeah, I'm great. I just made sure.
Okay. Thank you. And you can get it soapy wet each day in the shower. Make sure your hands are clean first. Then soap it up. Pat it dry. Put a little antibiotic ointment on it, and then cover it. I want to keep it moist and covered with antibiotic ointment and a bandage, sterile bandage. Okay.
Gotcha.
Do that every day. You should be okay. The biggest risk is bleeding at first, and that happens most commonly 48 hours. Within 48 hours. So I don't want you doing anything strenuous. No fast walking.
Only thing I'm going to be doing is my mouse with my computer. Is that okay or no?
Yeah, you should be okay. Just really gentle.
Because that's my job. I'm actually going back to work.
Today?
Yeah,
Really?
I was planning on it. I work at home.
What do you do?
I work for National Magazine Exchange.
Take a day off.
Oh.
And you just had surgery. I don't want it moving around too much. If you move it around too much, then you can start up bleeding here.
Oh, okay.
Looking good. Spot right on top. Just trying to look at it. It looks better than it did a minute ago, doesn't it?
Yeah.
So you keep doing that until we take the stitches out in roughly 2 weeks. Okay?
Gotcha.
I'm going to give you my cell phone number. You got any problems, you always got somebody you can call. Office hours, call here. After hours, call my cell phone if you have a problem.
Bless your heart. And what is your name?
Ron Perrott.
Because I'm going to have it on this video so people can see and come to you. And you don't just do this. You do facelifts.
No, I do mostly skin cancer surgery,
Oh, okay.
but I see regular dermatology patients Monday and Tuesday, a couple simple surgeries then, and then Wednesdays and Thursdays and Fridays all morning I do larger excisions and complex repairs, facial reconstruction, stuff like that. And
Really?
then and then in the afternoon I'll see a couple of extra regular patients. This looks good so far. I might put one more deeper one in there at the top. But it looks a lot better, doesn't it?
That thing is gone, so I'm tickled, okay? I mean, it looked better just wide open to me, but I mean, it's like as it was gone. Yeah.
Now the big thing is we just have to make sure it heals up well and you don't get infected. And that's really more up to you than us, but keeping it clean. Make sure your hands are washed before you wash it. Keeping it covered with a little antibiotic ointment and just minimize the use of it. Gives you the best chance. It's not foolproof, but it'll give you the best chance for a good wound healing, right?
I'm a big believer in antibiotic ointment.
We're going to give you a prescription for one.
Yeah, that's what he was saying. That nurse gives good shots. The little girl that numbed me up.
Medical assistant, who was that? Do you know?
Little short thing, black hair.
Danny.
She gives really good shots. She numbed it up really good.
I told her. Probably did.
I had her on Facebook Live, numbing me up.
That's fun.
Everybody was like, "Oh, I'm so glad you did this." And then I was like, "Okay, surgeon will not let me do it."
You can always post it. I just got to concentrate. I want you to have the best outcome,
Absolutely. When do you think it'll come back, like the feeling?
Usually you'll feel a little discomfort, a couple hours maybe, but it's usually mild discomfort, and we always give you a little something for pain, but usually just a little bit of Tylenol can take care of it. But the problem is that you don't want to take Tylenol and our pain medications at the same time because our pain medications have Tylenol in it. And the biggest risk is the Tylenol. You can take too much Tylenol and hurt your liver.
Yes. I try not to take anything because I have Meniere's, so it's like
Oh.
I don't like to take anything.
And you might be able to get away with anything, but just pressure's like 7.2. It looks good. Here, I'll show you the thing. Oh, you already.
Oh, I didn't see it.